to another edition of Perfect Love Nourishment Sessions. I am your host, Faythe Ford, and today we're going to be talking about how to perform what many people know as ear candling, but we also know the scientific name to be thermal auricular therapy. Thermal auricular therapy is a very ancient technique that dates back all the way to Kemet. Some people know it to be a part of the Greek and Roman culture, and we have utilized the strength and the beauty of utilizing this therapy for the healing modalities to help emphasize the immune system strength, detoxifying the lymphatic system, helping those that are suffering from ringing in the ears or tinnitus, those that are suffering from swimmer's ears, as well as excessive wax buildup in the ear canal. Today we have a patient who we're going to be administering to, and I wanted to start off by just showing each and every one of you what it takes to provide and perform an ear candling session. Alright, so without further ado, I'll start with the different things that you will need to perform. And I think I knocked down my lighter. But if you look on the table, we have the table set up, and it doesn't have to necessarily be a massage table. If you are a practitioner, it's a great thing to have it, for it creates a relaxing environment for your patient. So we have the table set up where you have your medical towels, and this is it's able to create a disposable way for you to go from client to client if you're going to have multiple clients throughout the day getting an ear candling done. If not, and if you're at home and you're just administering to a family member, you can perform them on a person's bed, on your couch, on a futon, something of that nature. In my hands, we have cotton ball. The cotton ball is going to be used after the actual ear candling is administered between ears, and that is a way for a person to be able to utilize getting the excessive oil and debris that may still be lingering after the ear candling is done. So we have the cotton balls. I have a pair of gloves. Whenever you're administering an ear candling or any alternative modality, this is a great way of being able to protect yourself and the client from any type of bacterial or viral exchange. We have a plate. It's just a regular paper plate. This is actually what is used on the candle, and you'll see once I actually start the process what this is used for, but it's to help prevent any type of wax to fall on the client if it would fall on it. I've been administering ear candling for 15 years plus, and I've never seen that happen, but it's just a safety precaution. On my table, we have a glass of water. A glass of water is what you're going to use to place your candle in, and this is what you will use. So you will stomp out the ear candle, so in between your portion of the session, you'll have your water to be able to do that. We have scissors. The scissors are what you're going to use to cut the ear candles themselves. They are something that you will just use throughout the process. We have some paper towel. Usually what I do is I use the paper towel to be able to put on the ear candles themselves, the cones themselves, so that it would not create any type of irritation. You know, it is wax on the candles themselves, so when you're actually placing them into the ear, you want to be able to have that as a safeguard. We also have what is called the ear candles. The ear candles are what you see in health food stores. You can find them at pretty much any health food store. I'm not going to say a supplement shop, but an actual health food store that provides, or a botanica, a place that would provide alternative modalities. And if not, there are companies, you just Google looking up an ear candle or an ear cone, and you can find companies that provide them at a very minimal, maybe costing no more than $2 a piece. I also have the ear candling oil. It's a combination of your calendula oil. I have a little bit of lavender essential oil. I have a little bit of olive, and we also have some mullein. Mullein is really good for breaking up mucus. It's really good for those that need a little bit of safeguarding in their ear, where there may have been some inflammation and irritation. So we have a combination of these oils and extracts and essential oils in here that we're going to place before I actually put the ear cone in. These are just my antibacterial aids, some hand sanitizer, and what I spray onto the client after the session is done. The only other thing that you want to have with an ear candling is a lighter. And the lighter, you know, whether it's matches, a stick of matches, just a regular big lighter, this is what you're going to administer to place onto the cone itself when you're applying the cone into the ear. So you'll see all of this process, but I just wanted to do the step-by-step of what you needed before we actually start. Greetings everyone, we're back, and we have our clients. They're actually ready to have the ear candling, the thermal auricular treatment done. And one thing I wanted to say to you guys with the plate, I've already done it, but if you can see in the center of the plate there's a cut. I just folded the plate in half, and I used my scissors to cut along the to the folding. And that way, when you're actually getting ready to put the candle inside, it makes it so much easier to be able to administer and put it inside. But before I start and do that, I'm actually going to place a little bit of the oil into the client's ear and massage their neck. That is something that is very effective as far as when you are wanting to get as much of the toxins and the waste material eliminated through the ear canal. Massaging in an upwards motion towards the ear is a very effective way to be able to get a lot more out. So we're going to first place the oil into the ear. Tilt your head a little bit. You feel it inside? Okay. And then you just take a few drops. You can either place it on your hands or you can place it directly onto the client. I like to place it onto the client myself, and then just start rubbing in an upwards motion. You don't need to do, you know, like a regular massage therapist would do, but you just do it in an upwards motion towards the ear, around the ear, and just, you know, you can go as far as the top portion of the neck. And this just opens the circulation process. It starts to break up some of that material that is going on within and around that area. and you'll notice, or your body actually will notice, the lymphatic system will start to really release a lot of those toxins that has been built up inside of there, because that's the system that collects all of your toxins in your body when your body needs to remove it out. And this is just one of the modalities that helps and assists with the process. One other way to help to cleanse your lymphatic system, your immune and your endocrine system, is doing jumping jacks and doing rebounding. So there are other modalities. This is just one of them. So now we're ready to actually place the ear candle into the plate. You just push it down into the center of the plate. And you're going to place it to where it's maybe about, I want to say 3/4 of the candle still left from the bottom of the tip of the candle to the plate itself, and then you have 3/4 of the candle still left on the top. After that, what I do is I take a piece of paper towel, and I probably should have cut it ahead of time, but that's okay. You just take a piece of your paper towel and you tear it off, or you can use your scissors, however you feel comfortable, because this is the one that's going to go wrapped around the candle itself. You wrap it around the candle, and what I like to do is just dip a little of it into the water. That way it'll hold on to the candle itself. You can place your finger into your water and then just place it on the paper towel, and that way it'll just stick to the candle, and it makes it easier when you're applying it into the person's ear. And so after that portion, we're ready to get started, y'all. We're going to angle the candle into the ear. Place it in an angle where the client feels it's most comfortable, and this is a very non-invasive system. So wherever the client feels like it's in its best position. Does it feel comfortable in your ear?
Yes.
Okay. So wherever the client feels that it is most comfortable in the ear and your plate is in the right position, then you're going to light your candle and you're going to start the process. Sometimes you'll notice once you light the candle, there may be a level of smoke that comes from the ear itself. If and when that happens, what you just have to do is reposition the candle a little bit, because the smoke is supposed to go inside of the ear and not on the outside. The process of what the smoke does, it helps with just like what you see going on right here, right now. So you just place the candle in a little bit better position so that the candle doesn't keep smoking. once that process happens, once the smoke stops coming out and you notice that it's pretty much settled into the air in its proper position, then you just let it do its thing. And it's going to burn for about 10, 15 minutes before you have to dip it into the water. And then you start the process over until it's ready for the actual candle to be removed from the ear. So we're going to let it do its thing and we'll return back in a few minutes. Hi everybody, so we are getting ready to take the candle and place it into the water so that we can administer the second portion of the candle back into the ear and finish the first ear. And you just cut at the end of where that blackness, where it has basically burned. And once you do that, you just keep it in the cup, in your cup of water, and you're ready to start the second process. And I personally like to massage the ear again, just to continue with that circulation, continue with the lymphatic drainage, continue with the removal, and just helping to stimulate that activity all in that area for the healing and the balancing processes to begin. And then once you do that, then you can place the candle back into the ear and start all over. Doing all right?
Yeah.
Okay. So then you place it back into the ear. Make sure that it's in a comfortable position for the client. And then you light it again. And it may have that screeching sound because remember it was wet a little bit, y'all. So don't be frightened by that sound. The main thing that I always want to emphasize is that your client needs to be in their most relaxed position that they can be, because this is a process by which they are removing things from their system. And even like when a person is being massaged and you notice that their muscles, if they contract their muscles more, it doesn't allow for the massage therapist to be able to administer as well of a healing process whereas if they were just to be relaxed, calm, and open to the process. So if you can keep them in a relaxed space by playing tranquil music, having water running, if you have one of those running water systems, we have chimes. You'll notice them at the end of the process. You'll see an aspect of what I consider tuning a person and getting them in more alignment with the balancing of themselves. All those modalities really help with the process of keeping the client relaxed and open to the process of the healing that they will incur or occur through this modality. So this time, hi guys. So we are at the final process of the first ear. We are getting ready to place it again into the water, and then finish up the process by placing the cotton ball into the ear, and then your client is able to flip over to the other side so that you can do the next ear. Okay. Another thing I wanted to express is that when you will know when it's really time to stop the process, with it as it gets closer to the edge of the plate, but also there will be heat that the client may feel, and you can ask them. You know, I've just been doing this so long that I pretty much know when to stop. But if it's too much heat that the client is feeling, then it's definitely time for you to stop the process and go on to the next ear. And what I like to do is just place the candle that's left, because we're going to look inside to find out what's actually going on with the client. But there is this much left of the candle, usually about this much, maybe a little bit less. And after that, we will start on to the next ear. Okay, so we're at the last stage. We are placing a little bit, maybe 1 or 2 drops more of the oil into the client's ear. And as you can see, I'm just taking a piece of cotton ball and I'm going to be placing that into their ear. And that is the final process of doing the ear candling. As far as what's inside of the cones, you can take your scissors and cut into the cone itself from the top portion, not at the end where you actually have the opening, but from the top portion that you were burning all the way down into the center of the candle, and open it up and see what comes out. If you notice that there is some brown resin, that is excess wax buildup. If you notice that there's more of like a powdery beige type of substance, that's a lot of sugar and yeast that is built up into a person. Sometimes you'll even see a little bit of water collected into the candle if a person is experiencing swimmer's ears. All those things will be removed, and you may even see some dark black speckles. If you see stuff like that, that is coming from excess mold or bacteria that may still be in a person's body. So don't be surprised at some of the things that you will see when you actually open up the candle. The last thing that I like to do, and this is just something, you know, like I was saying to you guys before, that I like to do for my clients, just to bring them to a little bit more alignment and balance to their well-beingness, and that's using the chimes. It's a really good practice for any health practitioner to be able to administer as much healing, balanced vibratory frequency to their clients' well-being before they actually leave off of their table. I'm actually going to make sure that my client just sits there and lays there for a few minutes before they just rush up. They want to be in the most relaxed place that they can be, especially if they're going to go out and leave from you and have to drive back home. So I just like to give them some time to recollect themselves, get themselves together before they just rush off to their next assignment. Thank you again for sharing your time with Faith Speaks with Perfect Love Nourishment. You can reach us at any of our social media outlets. We're on Facebook, Instagram, Tumblr, Twitter, all of those things. For those that would like more information about Faythe Ford or Perfect Love Nourishment Wellbeing Services, you can always contact us at 404-590-2472. Have a wonderful day, and I greet you guys with one perfect love. Namaste.